of total joint replacement surgery. Your options and their benefits to you will be explained, as will the important guidelines for postoperative care and compliance. The long-term goal of total joint replacement surgery is to provide pain relief, restore normal activities of daily living, and enhance your overall quality of life. Hip and knee joints worn out or damaged by arthritis is an age-old problem. There was no long-term solution for this problem until the early 1960s, when the first successful total hip replacement surgery was performed in England. By the mid-60s, total joint replacement had been imported to this country, and since that time has gradually been improved to the point where it is now quite successful. The results of this surgery have been spectacular, and the complications few, as the benefits are regularly extended to both the young and the young at heart. Unfortunately, there are common misconceptions about what total joint replacement is. Although it sounds like it may involve the amputation of a portion of your body, it is simply the resurfacing of the relatively small portion of your bones affected by arthritis. For most patients, this restoration of joint function returns them to an active lifestyle they haven't experienced in years. If you still have unanswered questions after viewing this video, please sit down with your physician, who will be happy to go into further detail regarding total joint replacement surgery. Also, you can further research the procedure and the implant technology your surgeon uses at www.smith-nephew.com. Arthritis afflicts 1 in 6 Americans and is the leading cause of disability. The most common form of arthritis is osteoarthritis. It is usually referred to as wear and tear or degenerative arthritis, and occurs most commonly in patients over age 50, but can occur at any age, especially if the joint has been previously damaged by injury. It is normally confined to the large weight-bearing joints such as the hips and knees, but may affect the spine and upper extremity joints as well. The most common symptom is pain in the hip or knee during weight-bearing activities, and in many people the pain is so severe that sleep is regularly interrupted. People with hip or knee pain usually compensate by limping or simply reducing force on the arthritic joint, thus weakening surrounding muscles and making joint stability a further complication. As a result of cartilage degeneration due to osteoarthritis, joints lose both flexibility and strength, and often bone spurs develop on the joint's bearing surfaces. If the condition is allowed to worsen, you may experience pain at all times, even during non-weight-bearing activities. This has obvious negative effects on your lifestyle, perhaps needlessly so. Total joint replacement is now a very viable and successful option for alleviating the pain that accompanies degenerative hips and knees, but it is not the only option. Before considering total joint replacement, you may want to discuss these non-surgical therapies with your doctor. An appropriate weight reduction program may be beneficial for decreasing force across the joints. However, this can be difficult for people with arthritis since the pain precludes them from increasing their activity and burning calories. Your doctor can prescribe specifically designed exercises to improve strength and flexibility without increasing your pain. Various medications such as non-steroidal anti-inflammatory drugs and nutritional supplements may be used to decrease swelling in the joint and provide temporary pain relief. Powerful anti-inflammatory agents and injections designed to improve lubrication can be injected directly into the knee joint. Bracing may be used to provide external stability to joints. Assistive devices such as canes and crutches may reduce the force transmitted to the joints during weight-bearing activities and thereby may help decrease your pain. These are just a few of the options to consider before committing to total joint replacement surgery. Although many of these solutions may help to temporarily alleviate the pain, they may not give you long-term relief and the opportunity to return to daily activities. If non-surgical treatment is unsuccessful, You and your surgeon may want to begin the discussion about total joint replacement.